Good evening from a hot and sticky Toronto. I shouldn't complain as it doesn't get to that stage very often. A warm welcome to all of our global guests to the Asia Pacific Foundation of Canada's online Asia Leaders Speaker Series with Audrey Tang, Digital Minister of Taiwan, with the session titled Leveraging Technology and Citizen Participation to Limit COVID-19 Spread in Taiwan, Approaches and Lessons. Mesdames et messieurs, bienvenue à la série en ligne de la Fondation Asie-Pacifique du Canada, série des conférences des dirigeants d'Asie. My name is Christine Nakamura, Vice President of Asia Pacific Foundation of Canada's Toronto office and your host for this evening's event. Before we begin, on behalf of the Asia Pacific Foundation of Canada, I'd like to acknowledge that the places Canadians call home are the traditional territories of many First Nations, Métis, and Inuit peoples. I'd like to now go over a few housekeeping points before we start. This webinar is being recorded and will be posted on our website's webinar page shortly afterwards. Please submit any questions you may wish to ask the speaker in the Q&A box located at the top right-hand corner of your screen. Time permitting, we'll do our best to answer as many questions as possible after the presentation. Feel free to contact us offline as well, should we run out of time and your questions go unanswered. For technical support during the session, contact events@asiapacific.ca. And we have allotted 1 hour for this event tonight. It now gives me great pleasure to introduce our board chair and executive advisor international at Deloitte Canada, the Honourable Pierre Pettigrew. After being elected to Parliament in 1996, Pierre served in successive federal cabinets over a 10-year period as Minister of key portfolios, including Foreign Affairs, International Trade, and International Cooperation. He continues to share his expertise on international relations on a number of public company and not-for-profit boards. He holds a BA in philosophy from the University of Quebec and a master's in philosophy in international relations from Balliol College at the University of Oxford. He is the author of New Politics of Confidence, a book on globalization and the art of governing. It's my very big pleasure to invite Mr. Pettigrew to make opening remarks. Pierre, the mic is yours.
Thank you so much, Christine. Good evening and welcome everyone to our Online Asia Leaders Speaker Series. Bonsoir. Bonsoir à tous et bienvenue à notre série de conférences en ligne des dirigeants d'Asie. This is the third session of our online series, which the Asia Pacific Foundation of Canada launched in early May 2020. In our last two sessions, we heard from two South Korean experts who shared with us the effective measures taken by their government to swiftly contain COVID-19, which did not include a total nationwide lockdown. Dr. Noon, the health expert, reported that South Korea's successful approach in managing COVID-19 was a direct outcome of lessons learned from its 2015 MERS experience. South Korea suffered the largest outbreak of MERS outside of the Middle East. Given the public's harsh criticism against the government's response to MERS, President Moon and his administration took swift action to mobilize and implement measures, avoiding errors previously made in their response to COVID-19. We heard from our speakers that their approach included transparent, timely communication from government to public, timely implementation of an innovative drive-through testing system for residents of South Korea that produced quick results, the use of technology to track down and isolate infected persons, immediate exclusion of visitors from epicenters and regions where cases were spiking, and finally provision of masks to limit the spread of infection. Although it is a combination of these measures that enabled South Korea to contain COVID-19 in short order, the enviable level of testing made available to anyone who wished to be tested, whether symptomatic or not, is being lauded as key to their success. Early detection, though abundant testing enabled effective cluster busting, which in turn allowed the economy to stay open in South Korea. Today, we will focus our attention to Taiwan, whose approach to containing COVID-19 has been even more remarkable. Other than Vietnam, which has not registered any COVID-19 deaths to date, Taiwan, despite its proximity to the Wuhan center, has been successful in maintaining the number of confirmed cases at very, very low level. Since the first confirmed case of COVID-19 on January 21st, 2020, until yesterday, Taiwan has had 441 confirmed cases and only 7 deaths, an infection rate that of 1 case for every 54,000 people. It is also notable that 415 of the cases have recovered and only 19 cases remain active. Canada, on the other hand, has had 85,679 confirmed cases as of yesterday, or an infection rate of about 1 case for every 438 people, and regrettably, we have mourned 6,538 deaths. As of this week, provinces throughout Canada and jurisdictions around the world, including major European epicenters such as Italy, Spain, and Germany, have reopened and begun to reopen. Today, we have a rare opportunity to hear from Minister Tang, who was instrumental in the success of Taiwan's approach. It will be very instructive for us all and will hopefully help global efforts to contain the coronavirus, to avoid it, if at all possible, a second wave of COVID-19 until effective treatments and vaccines are developed. So enough said from me. I think we're all anxious to hear from Minister Tang on the key to Taiwan's success, which we hope Canada and other countries can replicate as we move forward and try to restore some semblance of normality in our lives. Thank you so very much, and back to you, Christine.
Thank you very, very much, Pierre, for your wonderful opening words. Before I begin, I'd like to say a few words about the minister, in addition to what we have provided to the guests before in our invitation package. This is the Foundation's second opportunity to host the minister as our guest, as we had a roundtable with senior innovation representatives in Toronto a couple of years ago when she visited Toronto. Minister Tang, one of the world's top open source software developers, has become an overnight sensation after creating an app that provides Taiwan's face mask inventories in real time to help combat COVID-19. This app is lauded for having avoided panic buying of masks in Taiwan and ensured equitable supplies for all of its people. In 2016, Minister Tang became the youngest Taiwanese ever to assume a cabinet post at the age of 35 and was listed on Foreign Policy's magazine's 100 Global Thinkers for 2019. She's considered a genius, having consistently and repeatedly scored 160 plus on IQ tests from elementary school and onwards. Minister Tang dropped out of junior high school despite being at the top of her class and being accepted at one of the most prestigious high schools in Taiwan. She told her school principal that textbooks were sorely out of date, at least 10 years behind, and so decided to revert to self-learning via the internet. She never returned to study at an educational institution. At the age of 19, she started her own IT company and has worked as an advisor for Apple on high-level artificial intelligence projects, including on the development of Apple's signature virtual assistant, Siri. Needless to say, she earned a great deal of money in a very short time, enabling her to retire at the age of 33 to do the things she wants to do, including her current job as digital minister. As a bullied child, because of her extraordinary intelligence, she has emerged as Taiwan's idol for its youth. I can go on and on about her fascinating story, but in the interest of time, and I know that everybody is anxious to hear her speak, I'll stop here. And so with no further ado, it is my great pleasure and honor to invite Minister Tang to take over the mic. Minister Tang?
Hello, very happy to be here and sharing some thoughts around how Taiwan countered the coronavirus using the power of digital social innovation. Social innovation, that is to say, people who participate from all walks of life in order to publicly benefit the society, is the cornerstone of Taiwan's collective intelligence response system. Would you like to show the next slide? Right. So, and it's the three main idea I want to share with you today is fast, fair, and fun. And the fast part is about surfacing important ideas and signals from the society. Next slide. For example, whereas many jurisdictions began countering coronavirus only this year, Taiwan started last year. Last December, when Dr. Li Wenliang, the PRC whistleblower, posted that there are new SARS cases with evidence, as you can see here in the picture, he got inquiries and eventually punishments from his local police institutions. But at the same time, literally the same hour, the Taiwan equivalent of Reddit, the PTT board, has someone with the name No More Pipe here, reposting Dr. Li Wenliang's whistleblowing. But instead of facing any discipline, the head of the CDC, the Center for Disease Control, immediately noticed this post and issued an order that says all passengers flying in from Wuhan to Taiwan need to start health inspections the very next day, the first day of 2020. And to me, this says two things. First, the civil society trusts the government enough to talk about possible new SARS outbreaks, not only in a public forum, but brainstorming on what to do. And the government trusts the citizens enough to take it seriously and treat it as if SARS has indeed happened again, something we've always been preparing since 2003. And next slide. Because of this open civil society, as you can see here, according to the Civicus Monitor, Taiwan is the only society in the whole of Asia with the rank fully open, and only one of the two, along with New Zealand, in Asia Pacific. We enjoy the same freedom of speech, the same freedom of assembly, the press, and so on as our Canadian friends, as other liberal democratic countries, but with an emphasis on keeping an open mind to new and novel ideas from the society. I would argue this is why our schools and businesses remains open. There was no lockdown of any kind. We only put a temporary halt to public gatherings over 200 people, and we're relaxing even that next week. Next slide. So one example, every day our Central Epidemic Command Center, or the CECC, holds a press conference, which is always live streamed. They work with the journalist community and answer all the questions like Ask Me Anything style, which is always live streamed too. And because of this, whenever there's new ideas coming in from the civil society, they can just pick up their phone and call 1922 and tell that idea to the CECC. For example, there was one day in April that a young boy who said they don't want to go to school because his schoolmates may laugh at him for wearing the pink medical mask. And it just happened that during this mask rationing system, some districts only get pink medical mask. So the very next day, everybody in the CECC press conference, as you can see here, our Minister for Health and welfare at the middle, all of them start wearing pink medical masks. And they continue to do so for quite some time, making sure that everybody learns about gender mainstreaming, which is again a social innovation. And this kind of fast response builds trust because your idea become next day's press conferences, and that builds trust between the government and people. Next slide. So while we are on the topic of mask, another focus is fairness. We decided very early on to ramp up the facial mask production, which was less than 2 million a day. Today, it's more than 20 million a day, so more than 10-fold increase in the production, making sure that everybody can use their national health insurance card to purchase masks from nearby pharmacies. And fairness is our guiding principle. Next slide. So this is something that South Korea learned from Taiwan. A month after we rolled out the system, they rolled out a very similar system and even reused our civil society developed map for stock level visualization. So we're very happy to help our nearby jurisdictions with these open innovations, which is always open source. So here you see that we published the stock level of all the pharmacies' mask supply. But unlike other jurisdictions who usually publish the freedom of information like every week or at fastest every day, we publish it every 3 minutes. And at the beginning, we publish it there every 30 seconds. And when you publish the stock level every 30 seconds, this is essentially a distributed ledger, because we do not put any restrictions on how to use these data. We trust citizens with open data. There's more than 140 tools from the GovZero community contributors that enable people, for example, who prefer viewing maps, or people who prefer to talk to chatbots, people with blindness who prefer to hear from voice assistants, including Siri, and all the other venues of accessing this information. They can get the same inclusive access about which pharmacy near them still have the mask. And if they go to one of the pharmacies, swipe their NHI card, which we have more than 99.99% of coverage, they can see in real time the stock level deplete by 9. Because you can collect 9 medical masks every 2 weeks if you're an adult, or 10 if you're a child. And if you swipe the NHI card and the stock level instead increase, you will probably call 1922 and report something wrong going on. And so this is a massive experiment in participatory accountability. And so this ensures that people who show any symptom, they will be able to take their medical mask from a nearby clinic, go to a local clinic, knowing that they will get treated fairly, and because this single payer system, they will not incur any financial burden. And next slide. And the civil society did not only present the information shared by the government, rather using real-time open data, they made dashboards that lets people see and analyze where is our supply growing, where is a undersupply, and things like that. And so this makes sure that every week when I show this dashboard to the Premier, to the Prime Minister, we can collectively change our supply strategy for the pharmacies based on the real feedback of the pharmacists. And so this whole ordering system is co-created with the whole of society. And based on the analysis, we discovered that we peak at the time around 70% people has collected masks, leaving 30% of people behind. And when we analyzed the numbers after a month or so of mask rationing, we discovered these are people who live in large municipalities, they're young, they work a very long working hours. So by the time they finish off work, all the pharmacies have closed business, so there's no way for them to collect masks. So a month after that, we introduced a pre-ordering system so they can collect from a nearby convenience store. Next slide. So you can see our Premier, Su Zhenchang, on the left, smiling happily here, on the day when we started working with all the convenience stores. So that's in addition to the 6,000 or so pharmacies, we now work with 12,000 or so convenience stores, and that can take the same NHI card. You can go there and pre-order and collect your mask anytime, 24 hours a day. And so we ensure fairness of all kinds. And this is interesting because this format is also used to counter disinformation and conspiracy theories. Next slide. As I mentioned, we're a free liberal democracy. we cannot resort to take down orders or other lockdown-like measures when it comes to the online speech. However, we discovered that conspiracy theories and disinformation often spread through a sense of outrage. If people feel that this is outrageous, people will share it. That viral meme will then have a basic transmission rate or not that is higher than 1, which means that it will go viral. So how do we inoculate against such kind of outrage? Well, we use another even more potent emotion, which is fun. So our counter disinformation playbook is called humor over rumor. Next slide. So this is one example. You see the same premier now showing his other side and wiggling his button a little bit. And the title here is a response to the panic buying of tissue papers. There was a rumor that says, because we're ramping up the mask production so much, and the same material is used to make tissue papers, we will soon run out of tissue papers. So the premier, within a couple hours, rolls out this mimetic, brilliant response that says in very large print on top, 我们只有一粒卡层, literally, we each have only 1 pair of buttocks, meaning that we don't need to panic buy tissue papers. It's super hilarious. And then it shows a very clear table on the right that says facial masks are produced using domestic materials, and tissue papers are produced using South American materials. It's not the same material. And this went absolutely viral. And because of that, people who have seen this message are inoculated. So when they see the conspiracy theory, they will not share it. It's like they're vaccinated against outrage. And so this panic buying phenomena died down within just a day or two. Finally, we found out the person who started to spread this rumor at the first place was a tissue paper reseller, go figure. And this is not just a single shot point in the social media. Next. Every single day, the CECC daily press conference gets translated by the Ministry of Health and Welfare spokesdog, or 总裁, as you can see here, our dog CEO. And it's interesting because in every ministry, we have a team of participation officers that work with people online to communicate and to listen to people. And they're all very versed in mimetic conversations now. And so the PO of the Ministry of Health and Welfare literally live with this dog. And so there's no need to pay Shutterstock or something. All they have to do is after each CECC press conference, go back home, take a picture of the dog, and we can translate social distancing, as you can see on the upper left. Indoor, you have to keep 3 doge apart. Outdoor, you have to keep 2 doge apart from each other. And you can see on the upper right, remember to cover your mouth and nose when sneezing. Do not do what the dog is doing. And on the bottom right, you do not put your hands to your mouth. You wash your hands properly with soap and so on. And these all went viral regardless of age groups. And so this cute dog memes make sure that our humor, our factual humor, spreads faster than rumor. And that is how we make sure that Taiwanese people feel calm and collected even during the pandemic, and that the social innovations can thrive, and the CECC amplifies the best ideas from the population. Next slide. So one of the ideas, and this is my last slide, is we crowdfund a website that tells the world how to learn from the Taiwan model. And this started from the social sector with a crowdfunding campaign and even with very cute art. So if you want to learn more, you can read more at taiwancanhelp.us as a website. And you can also see on the website that our mask donation for humanitarian assistance, including to the First Nations in Canada, is not only a gesture from our foreign service, but from Taiwanese citizens, because anyone can dedicate their uncollected mask rationing quota to our international humanitarian aid. So at the moment, like this very hour, there's more than 600,000 citizens who dedicated almost 5 million medical masks for our international friends using the same app that they used to pre-order the mask. And this is not a government initiative. This is just people calling 1922, saying that we have plenty of masks in our homes. We want to reserve these uncollected masks to our international friends. And lo and behold, we implemented that feature. So this truly is a reversal of traditional procurement idea, the traditional PPP, where the government decides the spec and the citizens and the private sector implements it. This is a citizen working with the private sector, figuring out what should go on and what is the social norm. And we become the procured, and we implement whatever the citizen has in mind every other week. And we make sure that we keep this 2-week iteration cycle in our digital response systems, and everybody can see the roadmap just by listening to the Doge CEO's cute mimetic cards. And so I think that's my allotted time, and let's go to the Q&A.
Thank you so much, Minister Tang, for your informative and presentation. And the humor definitely helps, I think, and I can see where the compliance came in from the people of Taiwan for the measures. So now we're open to Q&A, and I have tons of questions here, even if we don't get some from the guests. So I'm going to start off with one concerning masks, because masks really are a big issue, I think. And yes, and Taiwan has done such a wonderful job in ensuring supply and compliance with it. In Canada, health authorities and governments have been reluctant to endorse face masks as a means to control the spread of COVID-19, citing the lack of scientific data showing effectiveness. But after a couple of months of lockdown here and a spike in confirmed cases, our authorities have finally turned around and have begun to recommend the use in public spaces, particularly where social distancing cannot be followed. So in contrast, Taiwan has done so well, as well as some other Asian nations, on the use of non-surgical masks since the announcement of the pandemic. And so can you tell us, since January, Taiwan focused on ensuring the availability. And so you mentioned that there were 9 masks given per person. Go ahead.
So there's 9 masks per person if you're an adult, 10 if you're a child, every 2 weeks.
Now, was there a period in time where you had panic buying before your app was developed?
Right. There was exactly 3 days of panic buying because at the very beginning, we rolled out the mass supply, our kind of reserve to the convenience stores, and said that each person can only purchase 3 at a time. However, there's no way for the convenience store chains to cross-audit each other. And so there's no way to prevent someone who, if you at 2 a.m. the mask gets delivered to the convenience store, there's no prevention of anyone who rides a e-scooter and just go to all the nearby convenience stores and collect 3 each. So by the 6 a.m., there's no mask in supply. And that is actually what led to the mask map being developed by the civil society. The point in time where we did not have a real name rationing system is when we see the Tainan civic hacker Howard Wu Jianwei developing his own version of the mask availability map by essentially crowdsourcing people's response, so that you go to a convenience store, you see it still have mask supply, you register on his map, which used the Google Map and Place API. And in just a couple of days during this panic buying, he owed Google something like 20K US dollars just by the sheer usage of the Map API. And of course, this cannot get on. And so within like 48 hours, we worked with Howard Wu and other civic hackers to develop the same map by using the pharmacies, which can use the National Health Insurance card to prevent double buying of medical masks. And after that, there's no panic anymore.
I see. Thank you very much. We have a question from the audience here. They're asking the role of mobile apps in tracing, in cluster tracing or infected persons tracing. Are you using mobile apps in Taiwan?
No. We have not used any mobile-based contact tracing tools. There are individuals and social sector organizations that have developed such tools. There's limited use here because we never entered community spread, so it's not very useful, frankly speaking. However, we do work with, for example, the US de facto embassy, the AIT, on cohack.tw, cohack.tw, which enables our developers to provide such technologies to international communities in need of such app-based contact tracing. And I need to contextualize my answer a little bit. We did not have to use it because we do a very strict border control so that we don't have to do a lockdown or strict domestic control. If you're returning citizens from a high-risk area, which is pretty much everywhere in the world months ago, you are asked to go to a hotel to quarantine unless you have a spacious enough apartment or your house that you can do home quarantine, home isolation. And even if you do home quarantine for 14 days, we make sure that you register your mobile phone, and we use cell phone tower triangulation, which is the signal that already the telecom provider have to collect anyway, and use it in an out-of-purpose way, which is constitutional. We basically send a SMS whenever your phone goes out of the perimeter of the 50 meters or so around your home quarantine. And if you break the quarantine or if the phone runs out of battery, within minutes, a household manager or police just go and check how are you doing. And so that is why we can relax the rules domestically, and we don't have to do a lockdown, and we don't have to rely on Bluetooth or other app-based measures, but instead we do very strict border control.
On that, to continue with that, was there any time at the beginning when Taiwan thought about a lockdown, or was it always believed that you didn't need to go into lockdown?
Well, everybody remembered the hospital, the Heping hospital that was locked down in 2003. It was very traumatic for anyone over 30 years old, including myself. And so just by, summoning the word SARS, as Dr. Li Wenliang did in his whistleblowing, everybody has in their mind this unannounced lockdown of the Heping hospital for an indefinite amount of time, which was very traumatic. And our constitutional court, right after SARS, said that this cannot happen again. This was constitutional, but the legislation need to find alternative measures that do not end in lockdown, that is more effective, and that maybe have some harm to freedom of movement and privacy, but only for very limited and pre-announced slots of time, like 2 weeks of home quarantine, after which there is no constitutional case for the telecom to respond to your whereabouts, for example. And so that was all the measures that we decided that we would do after SARS, and we do yearly drills to prevent lockdown from happening. So it's on everybody's mind, but it's on everybody's mind to not happen.
I see. Another question from the audience here. Is Taiwan working on any new digital social innovation to keep people safe as countries look to open up and resume international travel?
Yes, certainly. So first of all, we're working to join some of those bubbles of travel. The term bubble has started to grow in the search trends around here. It was not a public policy term, but people are now working to propose all sort of interesting measures to keep this bubble afloat. So that, for example, we see that the New Zealand, for example, also has pretty good success in containing the virus, and we tend to see their numbers as trustworthy. And so if we can democratize some of the testing, and we are developing rapid testing technologies and contributing to the international community, perhaps we can cross-authenticates, cross-authorize each other's testing kits, so that you can do a rapid test before and after landing, and of course still wear a mask for extended number of days, but otherwise resume travel between two jurisdictions that have contained the virus. And this is useful in Taiwan because even now it's pretty hot it's very easy for even just a few people in the audience when it gets crowded and we cannot keep social distance to remind each other to start wearing masks. That is also a social innovation we're spreading because we build masks as something that reminds you not to touch your face and that reminds you to wash your hands properly. So it's mostly a psychological and social signaling tool. And this is something that we can all get behind, right? So even if just a few people start wearing masks, they're signaling to other people, even asking other people, hey, why don't you take care of your own health by reminding yourself not to touch your face and wash your hands properly. And when we do that, it doesn't really matter the material of the mask because it's a signaling tool, and it does, of course, prevent me from touching my face directly and reminds me to wash my hand. And so when built this way, appealing to self-interest rather than altruism or collectivism, we can very easily get the idea of wearing mask to grow even in a large crowd who did not first start wearing masks. And so the more jurisdictions that started to adopt the same kind of attitude, the more of them can we include into our travel bubble, because then the culture will enable our travelers there to also remind them to put on facial masks instead of seen as strange.
So, Minister, in Taiwan, are people still wearing masks today? They
Definitely.
are?
Definitely. Even though we use the same guideline as you currently do, which is keep social distance or wear a mask, people are keeping social distance and wearing a mask.
Very good. Okay. Here's a question from the audience. The point about public trust in the government is very interesting. Taiwan is reasonably homogeneous a country, and therefore gaining civil society trust in the government might be easier. Compared to Taiwan, Canada is very multicultural and not everybody has a strong trust in the government. What would be your recommendation to encourage greater public trust in the government?
Well, first of all, we have 20 national languages, and in the metro, you can hear 4 languages in all announcements. So I'm not quite sure where this homogeneous country come from. We're 23 million people with easily more than 30 cultures, including many new immigrants. But I think that the point here is the government should trust the people. The government should make ourselves transparent to the people. And sometimes the people trust back. And it's not the other way around, which is making the citizen transparent to the state. That's called state surveillance, or asking people to trust the government's orders. So we did not rely on any, for example, criminal penalty. We did not declare an emergency situation. We are still operating under normal constitutional continental law system, which requires parliament authorization for each and every measure that the administration is taking, and we need to provide account to the hearings for things like the digital fence that I just described, the home quarantine, electronic. And so by providing account, making sure that all those parliamentary inquiries are live streamed, and indeed by answering to each and every from the journalists. We work with journalist community who are our great ally, who are like detectives that can surface new corners in the society that we did not think of, and the new measures such as pink medical mask that can easily alleviate people's fear, uncertainty, and doubt. And so my recommendation, the 2 recommendations, first is to amplify the citizens' voices in a very rapid iteration cycle, like the daily CCC conference. And second, focus on humorous communication, because that resonates with everybody without leaving any culture behind. As you can see, the premier in that viral meme makes fun of himself, right? He did not make fun of any other person or culture. And that is the kind of humor that really do spread and ensure a pro-social rather than anti-social media.
And I know, Minister, that you have a lot of involvement in education in Taiwan. So here's a question from the audience. Schools around Canada have been closed since March this year, and most provinces will not have in-person classes until September, and maybe not even in September, actually. Canadian kids resist the notion of wearing masks. What advice and suggestions do you have for Canada or Canadian people so that we can convince our kids to wear masks and get them to do it willingly, whether for school or when in a crowd?
Yeah, so as I said, there is a different kind of psychology at work in Taiwan. We wear a mask because of self-interest. not because we quote unquote respect others or quote unquote protect other people from us, which are frankly speaking hard to understand even for adults and even harder to understand for children. And so it's easier if you just build it in a very straightforward fashion, saying, the coronavirus primarily spread through touching your face with unwashed hands. And that's a scientific fact. On surfaces that are contaminated because of the coronavirus spray. So instead of saying, any roundabout psychology, you just tell the kids, wearing a mask prevents you from touching your face. And when you try to touch your face with your hand, it reminds you to wash your hands properly with soap. And really, mask doesn't work if you don't have good hand sanitation habits. And that is usually the one scientific study that was cited by health experts around the world, saying that the people cannot be trusted to wash their hands properly, and therefore we should not mandate mask use. And in Taiwan, we read it the other way, saying that because we want to mandate mask use, we want to make sure everybody remember how to wash their hands properly. So we invented like nursery rhymes or things like that, like 内外加工大力丸, or those rhymes that you just read that and then you can wash your hands properly, kind of semi-automatically, and that's a hit in children's communities. So just go where the children are and record any number of short Instagram videos or whatever videos that's required, and make it very hip to wash your hands, and then wear the mask as a sign to remind yourself to wash your hands.
I also think that a number of Asian countries have come up with some cute masks for children too, anime figures, etc. And I think that could be encouraging for children as well.
Yeah, they can be encouraged to paint their mask or to find one of those, T-shirts that they've grown out of, right? Their fond memories, and they can wear a mask and resume some of their earlier memories, I guess, and things like that. And that, of course, also helps.
Okay. Another question from the audience, Minister, is physical distancing, I think you answered this, of 2 meters still required in Taiwan, probably in public places?
Two dogs. So
two dogs.
So that's 1 meter outdoors, yeah, and
okay.
1.5 meters indoors.
Okay, and will it remain? If so, will it remain for the foreseeable future?
I think so, because this is a very useful social signal to say that we understand there is no vaccine yet. So this physical distancing and wearing of the mask are like the physical vaccines. And so I think the norm has already changed. And people, as I mentioned, are keeping social distance and wearing a mask. And we see a sharp decline of all the other like influenza and other transmissible diseases because of that. And because of that, I think this is generally just a good health practice, coronavirus or not. So we expect that this will continue indefinitely, at least until the vaccine is available. But even after the vaccine is available, I can see some of the advantage of still keeping this as a norm rather than a rule. We never really fine people or do any criminal penalty. All this is just it's a good idea, let's share it in the daily press conference level. There's no general order or fines or anything for people not keeping social distance. So this relies on people to remind each other.
I see. Very good. Now, I'd like to ask a couple of questions we have here on the economy. Sure. Because Taiwan didn't do any lockdown, obviously a lot of your businesses were still in operation throughout the pandemic and still are. And so could you give us, just tell us a little bit, in what way did the pandemic affect in any way Taiwan's economy and your projections for a return to a semblance of normal in terms of your economy?
Sure. So some of the businesses did close. I think the only business that closed en masse was intimate drinking bars, where there really was no way of keeping social distance. That's kind of the point of not keeping the social distance. And that is really the only business that the CECC has specifically said that unless they can keep a social distance, they cannot resume operation. But they're very inventive. So they invented kind of plastic shields that you can wear in front of your face while still drinking liquor or things like that. And once those social innovation, I'm sure, started rolling out, they resumed operation. Most of them resumed operation last week. And so there's, I wouldn't say there's no damage at all, but there's limited damage to, for example, large gatherings, restaurants, night markets, who are usually very crowded but are now less crowded. Things that relates to, you know, eating and drinking in public places, obviously, because it's hard to do so while wearing a mask. And of course, international travel and tourism community, these are affected. But by and large, the economy operates as normal. And a week from now, if there's continue to be no community transmissions, we're looking to relax even those norms, and so that people can enjoy a totally normal life. Of course, provided that they still adopt the important technology soap to wash your hands properly.
Okay, thank you very much for that. Here's a question from the audience with respect to the travel to Wuhan after the announcement of the breakout. Can you talk a little bit about the human-to-human?
Sure.
Yeah.
Sure.
Oh,
Yeah.
You sent a team, I understand, of epidemiologists to Wuhan, and has there been any collaboration, information sharing, and whatnot with the Republic of China, with the People's Republic of China regarding COVID since then?
Yeah, there were 2 experts from Taiwan who visited Wuhan to gather information on the outbreak and the control measures implemented in Wuhan. I think it was on the 12th of January. So it began quite early on. And to be honest, I think the academic community in the PRC has been quite straightforward in providing their analysis. It's just they don't have a journalistic community on the same freedom of the press to work with. So largely, the scientific community have learned about how the coronavirus worked internally within the PRC system, but the citizens still do not learn of that at the same time. So on January 12th, for example, there's still many large gatherings happening in Wuhan, even though the scientists are reasonably sure there's human-to-human transmission, and this is very much like SARS happening over again because of the control of the speech in the PRC. And so on the academic level, working on rapid tests, on vaccination, on pharmacies, on manufacturing and things like that. I'm sure that through open access journal papers and preprints, people do look at what each other's measures are doing and learn from each other. But because we're a constitutional democracy, there are some measures that's taken by PRC that we simply cannot do without declaring an emergency situation and lockdown, which we, as I said, we're not going to go back to. So there's only limited applicability of what the Wuhan has done that can be done in Taiwan. But I think those early investigations by our scientists still help to inform them, even though they understand that the journalist community is kept in the dark of the scientific findings. That also serves as an example, I guess, of what not to do. And that also informed our CECC and the empowerment of the journalism community from the very beginning of the CECC, which established about a week after the visit to Wuhan.
Thank you very much. A question from the audience here, requiring, and not just in terms of wearing masks and keeping social distance, but in addition to that, how do you think the COVID-19 pandemic might change norms in Taiwan and across the globe in the future? Do you think it'll change the way people interact with each other?
It already had, right? I'm the first telecommunications minister in the cabinet. When I joined the cabinet 3.5 years ago, one of my 3 working conditions, in addition to radical transparency and voluntary association, was location independence. So I can be in Toronto and still consider myself at work. And so this enabled me to travel around Taiwan and hold local town halls and such. And at that time, people are not very used to this idea. Many of them remember teleconference, video conference as something that actually decreased social trust because of the sound problems, because you cannot make the expressions very much and things like that. However, we have seen now that when people clear away those cache, those memories from like 3 years ago, people nowadays with today's internet, with today's broadband, like with this event, I can see and hear you just fine, perfectly. Actually, much better than face-to-face if we had to wear a mask. We can make out each other's expressions if we wear a mask. So this is evidently better than a face-to-face meeting. And so because of this, even though we had no lockdown in school, schools still embraced distance teaching because they really want to avoid any large gatherings of like multiple schools or multiple class together in a very large gathering. So they still go to school, but they're like satellite places, and then they join together in a large virtual classroom. And so this just changed the way that people think of meetings, of travels, and things like that. And it also enabled, like the coronavirus hackathon, co-hack.tw, people from very distant fields to start working on the same problem of, for example, how to make contact tracing work better. And once they build this solidarity, previously only seen in, for example, climate change or counter disinformation, which are also, phenomena that cannot be controlled within one's borders, right? So these require international collaboration, but everybody experiences it on a different time scale. We think disinformation and information warfare is one of the highest priority. Canada may feel less like that, or our Pacific Island allies may feel that climate change is the most important thing to tackle, but Taiwan being a larger island may feel that, oh, it's just 1 or 2 generations down the line, and things like that. So we have different time scale. But for coronavirus, every epicenter is either 2 months before or 2 months behind of each other timeline. So everything we collaborate is on the spirit of international solidarity. And this experience, I think, will not go away. We will still remember, even after we develop a vaccine, how does this kind of international collaboration work. And Taiwan held such a video conference 2 days before the World Health Assembly with 14 like-minded countries and economies, and making sure that our experience, including the cute dog, is shared, and we can see this kind of minilateral relationship through video conference thrive during the coronavirus, and I would think will continue to thrive afterward.
Thank you for that. I'll be quick here. I mentioned to you, I think, when I last met you, that we're going to be leading a women-only business mission to Taiwan, and we're still coming once the travel restrictions are lifted. But we're focusing on the care economy, which includes healthcare, elder care, childcare, education. And so can you tell us a little bit about Taiwan's healthcare system, which was already highly valued by its citizens even before this crisis? What are some effects of COVID-19 that may have impacted on Taiwan's healthcare system? And are there opportunities for our Canadian businesses in evolving post-COVID healthcare systems in Taiwan collaboration?
Plenty of. So, for example, our national health insurance, which covers more than 99.99% of people, the single-payer system already ensure a fair universal coverage. But it's not until the coronavirus do everybody, well, not quite everybody, like millions of people, a significant portion, more than 1/4 of the community, subscribe to the Ministry of Health and Welfare's chatbot and install the app of the NHI, which includes their personal info bank of all the medical visits, all the pharmacies they visit, and all the prescriptions that they have had, all the diagnosis they have had in a single app form factor, because it's the same app that they use to pre-order the mask. Now everybody know that there is such an app available, and that they can join in data collaboratives or a data democracy. There's a recent book on this to voluntarily join together in a care community that collectively determine how to use this intersectional social data for good. And instead of being passively observed and collected, rather they can actively curate. And the mask dedication is the first of such data collaborative being spawned on top of this NHI virtual platform. They can choose to review their real name, like the PII, that's a personal identifiable information, but it's only associated with a date and how many masks they did not collect. So this is a minimal privacy harm. There really is no way to infer anything else about me. And in exchange, our mass donations to international communities, including Canada, come with this Taiwan Can Help That Us slogan, where you can follow the hashtag and learn the 300,000 people who choose to reveal their name, who provide the mask to you, and the other 300,000 who did not reveal their name and prefer to do so anonymously. So I think a new norm around data democracy is happening in Taiwan. And if you're looking into providing value to those care communities using novel techniques, such as open algorithms, federated learning, and things like that, there's a very much thriving community in Taiwan that you're very much welcome to join.
Very good. We'll come to see you. But I'm going to, we have time for one more question before I ask our CEO to make closing remarks. And the question comes from him, so I have to ask it. How has Taiwan dealt with the privacy issues in the context of artificial intelligence, digital innovation, and the COVID response?
Yes, so for contact tracing, I explained the digital fence, which is a constitutionally allowed alternative to physical barricading the hospital. You can choose either the quarantining hotel, which is kind of a physical perimeter, or use your phone, and we do not collect extra data. We just use it in a way that's out of its original purpose for 14 days. So that is a narrow, deep, timed harm to privacy for the public good. But other than that, most other digital innovations came from the civil society, and the controllership, as I explained, is jointly held by all the application developers of those communities, including the mask availability map and things like that. And so what I'm trying to get to is this is a new norm of social sector control of data. And people who care about each other, like I don't care about any random person's temperature, but I may care about my family's current temperature level. I may remind them to stay at home more if they are feeling unwell, and so on. And so we enable these communities with open source tools to record their whereabouts, record their symptoms, selectively share it with their families. And when the contact tracers do come to them, they can share only the pertinent information for contact tracing instead of sharing, revealing other people's private details accidentally. So this is a privacy enhancing technology with social sector control. And we think this is a better norm because it enables us to foster democracy during coronavirus as opposed to state surveillance or relying entirely on multinational capitalist regimes. Sorry, not regimes, companies.
Okay.
Yeah.
Thank you very much. Then with no further ado, I'm sorry, there's tons of questions still coming in, but we're running out of time. So I'm going to have to call upon our President and CEO, Stuart Beck, to make closing remarks and to thank you, Minister Tang. Stuart?
Thank you very much, Chris. This has been a fabulous session, Minister. Information rich, and your delivery was just perfect. And I have to say, humor versus rumor is going to be something that's going to stick with me for a while. So I think congratulations on that. And as I mentioned before we got on the session, I spent 4 years in Taiwan working at the Canadian Trade Office in Taipei back in those days. And I have to say one thing I learned from that exercise, as I said, 95 to 99, was how Taiwan had transitioned from being a traditional industries-based economy to an innovation-based economy. And really, that transition, you see today in terms of how you're dealing with an incredibly difficult situation and manage your way through this in a digitally effective way, which I think is so important. The other message that came out from my mind, because I was also in Shanghai at the time of SARS, is the whole question about pandemic preparedness. You took lessons, Taiwan took lessons, Korea took lessons, Korea took lessons from MERS, Taiwan's taken lessons from other pandemic episodes, and the economy and the people were prepared for this. And again, yeah, society is quite a bit different in some ways, and it's not a question of homogeneity, but again, we're a big country, federation, and because of that, everybody handles things a little bit differently. So if you take a look at British Columbia, we've done quite well. Closed the border with Washington State quite early, but we also had the benefit of knowing our student break week was 2 weeks behind Ontario and Quebec. So we were learning from those types of mistakes in BC. And of course, we had someone like Bonnie Henry, who, like in your case, every day giving briefings that people listened to and knew and understand, and became a very trusted person in the context of the coronavirus response. So these are things that I think we all need to take away. So the session that you've given us today has just been so rich in terms of information, and we're so grateful for you that you've taken the time to do this. And I can say that, and Chris knows this for a fact, that I was really pushing to have Taiwan as our second destination for our women's entrepreneurship mission, because I just know the ability for Canada and Taiwan to collaborate around innovation and technology is really works both. We're both in the same situation and have a tremendous opportunity. So again, I'm looking at the time. Thank you very much. And I hope we have a chance to meet sometime in the future in person.